So I think I will start now. So today's topic of presentation is power of peer support in managing chronic pain. And so before we begin, this is my first time hosting a webinar for Pain BC. So before we begin, I'd like to offer a land acknowledgement. The standard land acknowledgement is on the screen, but I also wanted to share a personal revelation to introduce myself. My name is Divya, and I'm the engagement lead at Pain BC. I do not live with pain personally, but my loved ones do. And I grew up in India, and I came to Canada in 2018. And I have been developing a relationship with Canadian lands and water for the past 5 years. Currently, I live and work on the traditional unceded territory of the Algonquin Anishinaabe people. And today it's an honor to be with you all. Now, this webinar, this program has been made possible through financial support from the CIHR Institute of Musculoskeletal Health and Arthritis and the Partnership for the Engagement of Patients in Pain Research. Now, we hope you will ask a lot of questions and participate in today's webinar. To ask one of our presenters a question, please use the Q&A feature in your Zoom toolbar. Note that we will not read your name out when asking your question. If you have any technical question or have a question for me, please type in the chat. Now, today we will be using the auto-generated closed captioning feature for this webinar. So view the captions, follow the instructions on the screen, depending if you use the desktop computer or a smartphone. For today's webinar will be recorded and posted on Pain Canada's YouTube channel. Just pasted on the slide. And if you have any questions, please don't hesitate to ask us or write us back at education@painbc.ca. Now, we only have 1 hour, and this is our rough agenda for today's presentation. Introduction to the topic, housekeeping, and introducing the presenters. Then Delane and Jenny will introduce the topic in detail, followed by Susan and Sage's presentation. Then there will be a short discussion between the four of the presenters and sharing of resources, and followed by the audience Q&A. In this webinar, we do have some poll questions, so keep tuned. So now I would like to invite Jennifer, who would like to introduce herself and do the land acknowledgement.
Thanks, Divya. So my bio is here up on the screen with a picture of me and my big, large mug that you'll see me drink from. So my name is Jenny Lorca, and before we begin, I'd like to acknowledge that as a child of immigrants, as a settler of color, and as a lifelong resident of the Greater Vancouver area, I am so grateful to live, work, learn, play, love, create, and pray on the unceded, ancestral, and traditional territories of the Coast Salish peoples, namely the Staulo, who took their name from the Staulo River, aka the Fraser River, the Katzie, the Kwantlen, the Kwikwetlem, Kite, the Sembiamu, the Tsawwassen Nations, and the Sanek, who have since time immemorial have been the caregivers and stewards and knowledge keepers of the area known as Surrey, where I currently live. I honor the Musqueam, Tsleil-Waututh, and Squamish Nations of Vancouver proper, where I grew up, and I also honor the First Nations, Métis, and Inuit people with whom I have shared bread, knowledge, wisdom, and support. And just to sort of, as a precursor to this entire event, it was important to us to make sure that that we invite you to to come as you are, to be curious, to stay curious and interested, to ask questions. As Divya said, please put them in the Q&A. And, during this lively discussion, we will get to them. We also invite you to, respect differences, to understand and acknowledge that we are all on different journeys, particularly those who live with pain, and that, sometimes stuff can come up during an event such as this. So we invite you again to, to take care of yourselves, to listen to what you need, to get up if you need to look out the window or leave the webinar altogether, because this is being recorded and you can come back to this at a future date. So listen to yourselves and honor yourself for being here. So thanks for that.
Delane?
Yeah.
Did you have something to add, Jenny?
No, it's all good. It'll come up, I'm sure.
Thanks,
you.
Jenny. Thank you, Jenny.
Hi, everyone. My name's Delane. I'm so grateful to be here today. So I am a person who lives with pain. I am also a PhD student at the University of Guelph, and I'm studying clinical psychology. And so since I am in Guelph today, I'd just like to acknowledge the stolen land and traditional territory of the Anishinaabe, the Attawandaron, and Haudenosaunee peoples, and the treaty lands and territories of the Mississauga of the Credit. I am grateful to get to learn and work and grow relationships on these lands. And I'm grateful for everybody who is joining us from across Canada today. And so, as Jenny mentioned, we are really hoping for this to be a place where we can all discuss and share experiences of peer support. I know that all of us on the panel today are super passionate about peer support, and we are super excited to get to talk about it today. In terms of the learning objectives, what we're going to be hoping to kind of go over today is we want to discuss some of the benefits and challenges of peer-led pain support. We have Dr. Susan Holtzman and Sage here to talk about some preliminary research findings of the impact of peer support groups on community members living with chronic pain, and understand how participation and facilitation of peer-led pain support groups can impact one's sense of community, pain self-management, and quality of life. So yeah.
Please go ahead, Dr. Susan Holtzman.
Hi there, everyone. Thank you so much for the opportunity to join this webinar today. Sage and I are both joining you from UBC's Okanagan campus, which sits on the unceded traditional ancestral territory of the Silks Okanagan peoples. I have been a faculty member at UBC Okanagan since 2009, but I've actually been studying the connection between social relationships and health for over 20 years now. I have been very passionate and continue to be passionate about understanding how we can boost social support and mental health treatment for those living with chronic pain. I myself do not live with chronic pain, but I have very close family members who do. I hope you all enjoy the conversation. I know I'm really looking forward to this today. We've been working with Pain BC for a couple of years now, and I'm really excited about all the exciting directions that lie ahead. So thanks again for having us.
Thank you. Eight.
Hi everyone, my name is Sage. I'm really grateful and excited to be a part of this webinar. I'm heading into my second year of my master's in clinical psychology at the University of British Columbia's Okanagan campus, which, as Susan said, is situated on the traditional unceded territories of the Silks Okanagan peoples. My current research is looking at sort of digital communication and how this type of communication can be advantageous for populations and communities such as those with chronic pain, and making the experience of living with pain as advantageous as possible using this new digital communication and technology that we are kind of moving into as we go through this societal shift towards digital media. I'm also interested in rural and remote access to mental health services and increasing offerings for support and connection for people living with pain in rural communities as well. So I'm really excited to be here and to chat with you all.
Thank you. And I will stop sharing and ask Jenny to delay and Delane pitch in. Thank you.
Thanks, Divya. So in my excitement to talk about, a comfort agreement, I neglected to introduce myself. My name is Jenny Lorca. I've been a volunteer with Pain BC since 2019. I've also been living with chronic pain, complex chronic disease since that time. In my multiple roles with Pain BC, I am a facilitator of the pain support and wellness groups, both in one region and also the BIPOC group for people who identify as Black, Indigenous, a person of color, a body of culture, biracial, multiracial, and that is these demographic groups, the BIPOC group, the LGBT2S, LGBTQ plus group, and the young adult group are quite new to Pain BC. So I hope to bring my experiences as a patient partner, as somebody who lives with pain, as a facilitator, and as somebody who is really invested in peer support in my expanding community. So please ask questions of us. This is meant to be an interactive event. Delane, go ahead.
Thanks, Jenny. Yeah, as Jenny mentioned, we really hope that we can get thoughts and questions. So feel free to pop those in the Q&A and in the chat. But really, just to start us off today, we wanted to just kind of center ourselves around what peer support is. And so I think before we get into that, I think we might have a poll for people. So we'll get that up here. I'm not too sure if people can see the poll.
Yeah, we got the response was like 100% true.
I think that might have been for a previous question, perhaps. I'm not too sure. It might have come up differently for me, but
that was the question of loneliness and cigarette smoking, I think it was, and all 16 responded. We had 100% response. So we've got a second question that showed up, which is, what has been your most valuable takeaway from peer support? And we'll give some time for that for those of you who are attending to answer that question.
It's again a social connection. Okay, we are getting some results.
all right. I don't know where the responses are at.
So for the second poll, 81% participated. The question was, what has been your most valuable takeaway from peer support? Pick one. So that was social connection, 54%, strategies for living with pain, 23%, growing as a person, 0%, pain education, 8%, community resources for chronic pain, 15%. This was the second
Okay.
question.
So I
That's
think
great.
we'll put a pause on the polls for now. Sorry, Jenny, did you want to say something?
No, I just wanted to make a comment on that it sounds like the people who did respond have had experience in peer support, being supported or supporting other peers. So why don't we talk very briefly on what peer support is, and then we'll roll into Susan and Sage's presentation. Yeah.
Yeah, sounds good. So like Jenny said, it sounds like some of you have participated in peer support. And so really when we're talking about peer support, what we mean is that people with shared experience for this context, people with chronic pain coming together and spending time with each other to share their experiences, to share strategies, to build that connection, like some of you had answered in the poll. And so it's really, when it comes to peer support, you know, it can look very different. It can be in groups, it can be in one-on-one settings, it can be online, it can be in person. So there's lots of different ways that peer support can look. And even sometimes, you know, people think about peer support in terms of it needing to be formalized, but it can also just be, you know, two people sitting down, right? Jenny and I often talk about this when we meet and how sometimes things just come up and we always say like we're engaging in peer support right now with each other, right? So it can be that informal peer support as well. Not too sure, Jenny, if you had anything to add.
No, I was thinking, thanks, Dolly, that was awesome. I was thinking about who engages in peer support, and you know, when I think of like, and where we see peer support already in the community, not necessarily in the pain community, but things like new moms groups, or I don't know, hot girl walking groups, or like just how it is, as you said, the shared experience brings people together. And when I think of my own experience as somebody like was newly diagnosed with a host of conditions, and living in a body where I felt like I was totally betrayed and feeling totally alone and isolated, and none of my friends or family had any kind of the same kind of any kind of experience as I, that, you know, that peer support really pulled me, it pulled me out of this spiral that I was in of, you know, fear and self-loathing and confusion and pain, like all kinds of pain. So I just wanted to give a shout out to the first peer support group that I attended, to the leaders of the peer support, and to who became my mentors when I became a support leader. And to Pain BC for providing this opportunity for us to find each other, and again to also and to continue to support me as a facilitator. So thanks for that. If there's anything else, is there anything else we need to add, Elaine? No? Sage and Susan, how about we hear from you? I'd love to hear about the research.
Absolutely, thank you. I'm just going to take a moment here to share my screen. And hopefully this works. Oh. How's that looking for everybody?
Good, we can see it.
Okay, the hardest part is over. So congratulations, 100% of you were 100% right on that first poll question. We couldn't fool you, and I guess if you're here, you probably have already experienced just how important peer support is. And it turns out that there have been, over the past 50 years, thousands of studies showing the benefits of strong social relationships, and over 100 studies showing that over time, people that have strong social connections, strong ties to the community, this is actually as powerful of a predictor of illness, developing disease, disease severity, even mortality, as things that we would commonly associate with those types of outcomes, like physical activity and cigarette smoking. Now, if you're somebody who struggles to get the support you want and need, this is maybe almost a little bit stressful to hear, like, okay, now I have this other problem. But the reality is, if you are living with a chronic illness and chronic pain as one of them, it can be difficult to build and maintain social relationships because of the physical symptoms, the fatigue, the pain itself, but also it can be difficult to find people that understand what you're going through and that can really validate your experiences. And we've heard Jenny really speak to that so eloquently, and that is one place where peer support can be so valuable. And so over the past couple of years, we've started to work with Pain BC to try to examine systematically the great work that's already been going on for a long time. And in fact, we've been working closely with Melanie McDonald and Carmel, who have been collecting, along with the pain support team, these great surveys following each support group. And Sage is going to tell you a little bit about some of the work we've done to analyze the responses from all the literally hundreds of polls that they've conducted. And so you'll hear from Sage a little bit about the results, where we've really delved into those survey responses, as well as another survey that is more recent that we're actually conducting right now. So I'll turn it over to Sage to tell you a little bit more about that first study.
Alrighty, so for the first study, after we kind of entered into a collaboration with Pain BC, we kind of sort of wanted to figure out what we wanted to find from this amazing pre-existing data that Pain BC had collected from participants in their online peer facilitated support groups. So we wanted to get a sense of overall levels of satisfaction with these support groups on behalf of the actual participants that are taking part in these groups. And then beyond this, we also wanted to get a sense of what the participants found to be their most valuable takeaways from group sessions, and if we could find any patterns here in the responses we had. So we were super fortunate to have access to a pretty massive data set of 743 responses to Pain BC's anonymous feedback survey that they sent to participants after each group session. So we were able to analyze these responses for overall satisfaction levels with the group, and we were able to locate themes in the open-ended responses that participants gave when they were asked the question of, what was your most valuable takeaway from this session? So that was the data we analyzed. And from this data, we found some pretty positive results, and we were actually fortunate to present to fellow pain researchers and clinicians at the Canadian Pain Society's 2023 conference. So in terms of satisfaction with the group sessions, we found that 95% of respondents rated the sessions as either good or excellent, with the lowest rating only being down to average. So nobody rated the sessions as poor or very poor at all. And then in the same vein, over 90% of participants found the group sessions welcoming and respecting atmospheres, and they found that the session content was very useful and easy to understand. And then when it came to the open-ended responses, this kind of goes in the same vein as the poll question that you guys answered a little bit earlier. So the questions that we asked you, the options, were actually what we saw coming out of the data as the 5 sort of categories of most valuable takeaways. So you guys indicated that one of the most valuable takeaways was social connection, which was also what we found in the data. So participants really valued the connection with others with pain that these groups allowed, and they often stated in the responses the phrase, "not alone. I realize that I'm not alone." And that was something that came through quite a lot in the data, so that was really cool to see. Participants also valued learning strategies for living with pain. So whether this was mindfulness, physical activity, or exercise, or simply just advocating for yourself, either in the healthcare field or in the social spheres or anything like that, that was also something that people valued as a takeaway. And personal growth was also a valuable takeaway, and this often came in the form of gaining a new perspective from the group, learning from the facilitator, or learning from someone else in the group that's living with pain. And then pain education topics, such as the connection between stress and emotion and pain, learning things about pain and how it works was also valuable to participants. And then finally, participants valued community resources and information, such as learning about a new alternative therapy that they've not heard of before, or learning about pain-specific resources like clinics in their community. So that was kind of the most valuable takeaways that we were able to pull from those responses that we got.
Thanks, Sage, and it's really interesting to see the how commonly these are experienced in these over 700 responses. Even in our small group that we have here today, it seems like the pattern of findings is quite similar, and we do see similar patterns across other peer support groups that are happening. So this is great and very encouraging, and it shows really the depth and the breadth of impact that these can have on people's lives. But there's still some unanswered questions and places we can go with the research. And so we'll tell you briefly about the next sort of phase that we're doing. There was a question, what types of peer support groups did you survey? That's a great question. So on the responses that we just summarized here are from the online peer support groups that were peer facilitated groups that were led by Pain BC. Sage, do you remember the exact year that the data was collected?
I think this was between 2021 and 2022 for the open-ended responses specifically.
Yeah, that sounds about right. So it was after the pandemic had already occurred, and these are all online peer support groups. But as we've already talked about, peer support can look really different. It can take so many forms. So this is one very specific type of peer support. And we want to acknowledge and discuss with everybody here too about the fact that this format doesn't suit everybody and isn't a good fit for a variety of reasons. And so one of the things that our lab is really interested in learning about is how can we sort of break down the barriers to connecting with peers that have pain, when this may work for some people, but it also clearly is not the best preferred way to accessing peer support for a lot of other people. And so we're really interested in finding this out. Online support has opened up a great option for people. I think the pandemic has been terrible, but it has sort of created shifts that have benefited people. And one of them, I think, is a greater openness to accessing online support. Before we kind of shift over to some of those really great conversations, I'll share with you just where we're going with our next little study here. And one of the things we don't know a lot about in research on peer support groups is what the impact is on health over time. So we know the experiences within sessions are often very positive, but we're looking in this next study to follow people over a whole year. So people that are taking part in Pain BC's online support groups, including the new ones that allow people to find those that are more consistent with their own personal identities in a variety of ways. How does this impact their health and well-being over time? And also, what predicts, people sticking with the groups? Are there factors that predict who drops out, who stays, who comes and goes? So really trying to understand sort of the dynamic nature of these groups, because they are drop-in groups, which is I think a real great advantage of it. So far, I'm excited to report that we have over 40 people that have filled out our baseline responses, and these individuals will be getting follow-up surveys from us every few months to see if they're still engaged, if not, why, and what their health and functioning is like over time. And so hopefully we'll get to join you another time in the future when all of this data is collected and we can share with you the results of what we've done here. So thank you for I see another question here. Oh, can I take this question? Can I see? Okay. So the question, can everybody see the question here? That's there. I can read it out. Is your organization compiling a list of all Canadian, not just BC, online peer-led support groups for illnesses that deal with chronic pain like fibromyalgia? This would be especially helpful and will support grassroots organizations led by volunteers to raise awareness of their existence. I love this question. In fact, when we were preparing for this webinar, we actually talked about this very thing. And it does relate to the fact that the openness and availability of online groups has just exploded in the past couple of years. And it's almost overwhelming if you're someone who lives with pain and trying to seek out a group, like, where do I find these groups? And it doesn't have to be people in BC. It could be anyone, anywhere really at this point. So we are working on something that we'll be able to share that helps distill and organize this type of information, and hopefully engage those of you who are using these other groups so we can learn about what's going on and facilitate communication around that. Thank you so much for bringing that up. I don't know if anyone else has anything to say, but I'll stop sharing my screen here and open it up.
There's one more poll question.
Oh yes, thank you. This kind of goes back to that idea that online support groups are not accessible for everybody, nor may they not necessarily appeal to everybody. And so we had a question just relating to what might get in your way of participating in peer support groups. And I believe you can check, I'm not sure if this poll will let you pick all that apply. If you can, please do, because often there are multiple reasons.
While we're doing that, I also want to really acknowledge the last question that came up about other online support groups and condition specific groups. For myself, I say that, like, there, as Susan mentioned, there is a list that is being compiled. It's a matter of how that information is going to be shared and with whom. But in the meantime, though, I mean, I know I'm talking about Pain BC specifically because that is my region. But I will do is share a couple of resources that that are in Ontario, that are in Quebec, that are in Atlantic Canada, that all have in-person and or online groups. So I'll put that in the chat when we do that.
So looking at the answers here, there's obviously a wide array. This is interesting to me that almost half of you feel like there isn't enough time to participate, which is very valid, and would love to unpack that. Not enough energy, also very common. Energy and time outweighs pain, which is interesting, right? And just because you live with pain doesn't mean that's your, I mean, you have a whole life around and outside your pain, and it may not be just the pain that gets in the way of participating. Everyone's lives are just so busy, seem to be getting busier and busier every year. And would love to hear any other reasons that we obviously had only so much room to provide some suggestions, but what else? Are there any other things that get in the way, or maybe sounds like a lot of you have participated in these groups yourself, but have we missed anything?
maybe while people, if people want to answer, I can contribute. You know, one thing that when I've spoken to people about attending a peer support group, and even myself, the first time I was looking for a peer support group, I was quite young. It was when I came, so I grew up with chronic pain. I had chronic pain throughout my adolescence. And so when I turned 18, I was looking for something, people I could talk to, people I could relate to, because as a young person living with pain, I didn't have anyone. I did feel alone. I was super isolated. Nobody understood what it was like. And I know that's not just for adolescents, but that was my experience. And so when I went to look for a peer support group, um, all those years ago, I mean, it was difficult to find something. Like we've been talking about now, there are more peer support groups coming out, which is wonderful. And I think something that got in my way was putting myself out there to a group of people who I didn't know. Maybe it also had to do with the age thing. I mean, I had just turned 18. I was a bit nervous, like, am I going to find people around my age? Are they all going to be older? What does that look like? So I think there's something to be said about with peer support comes a little bit of, not a little bit, but quite a bit of vulnerability, putting yourself out there, sharing your story, sharing your experiences. And so, although it can be extremely liberating and helpful to share those, if it's your first time doing something like that, it can be nerve-wracking and it can be worrying. So I see that we have some more questions here.
Sorry, before that, we have one attendee, Carmen, has a question. She raised her hand.
I saw Melanie also had a question about experiences being a peer facilitator as well and the impact on you.
Okay, so just to scrolling in the questions, and thank you for engaging in this conversation with us. Just to go back to a couple of things that Susan was talking about with respect to what the barriers were. Someone put the timing of the groups, and they also said some groups are quite late in the evening, and I agree. For in with KBC in particular, and again, that's my context. We have two groups a month, two regional groups a month, one in the morning from 11 to 1, and one in the evening from 6 to 8. And as a facilitator, I know that my capacity, I can only do the daytime group. I can only facilitate the daytime group. At the same time, I facilitate the BIPOC group in the evening on an alternate Tuesday, and it takes a lot out of me. So it's part of it is a balance of, who is available during those times, like to facilitate, not just the facilitators, but the staff, and what are our collective capacities to facilitate and attend. And to the person who did, I also want to draw your attention to the resources that I put in the chat. So the PIPAIN, the People in Pain Network, they're based in Atlantic Canada, but their online groups are open to anyone across Canada. So perhaps you'll find something that fits you, your timing and capacity there. I also want to draw your attention to the Power of Pain Network. They have a portal where you can find resources, webinars, and it's another portal where you can also get connected to other pain support groups that I haven't, peer support groups that I haven't listed here. They have a webinar. Last month they had a webinar on peer support, and so I see our gathering today as sort of a continuation of that webinar, which was presented by Melanie McDonald from Pain BC and Virginia McIntyre from People in Pain Network. The AQDC, the Association Québec Douleur Chronique, I'm assuming that their groups are French speaking, and at the very least, there is another resource for you. So, with respect yeah, go ahead.
Oh, sorry, Jenny. I just wanted to add on to that. Also, the People in Pain Network has a young adults group, so that's people who are aged 18 to 30. And again, I just bring that up because for younger people who are looking for connection, that's there as well. And then the Power Over Pain portal is currently working on peer support as well. They are currently studying it. And so if there are any youth in the audience, or if any audience members or even any panelists know any youth with chronic pain, the Power Over Pain portal has actual built-in peer support for youth with chronic pain.
Mm-hmm. Thanks for that, Elaine. One other question that came up in the chat. So I'm just going to read it out. Fibromyalgia Support Network moved from being an in-person group to an online group to respond to the desperate need for connection and socialization during the pandemic. We also moved from being a London, Ontario, and area group to accessible to all Canadians and people with fibromyalgia and other chronic illnesses, regardless of where you live in the world. That's wonderful. Thank you. One of the ongoing struggles with grassroots groups or registered nonprofits is access to government and provincial funds. What can your organization do to advocate for inclusion of such organizations in funding opportunities offered only to registered charities or nonprofits? Some groups don't even have the funds to apply for incorporation. And Maria Hudspeth, who is the executive director of Pain BC and all sorts of really wonderful things with Pain Canada, she is here present to answer this question for you. So thank you so much, Maria.
Thanks, Jenny and Jacqueline. Thanks for asking this question. So one of the things, if people are familiar with the National Action Plan for Pain in Canada, one of the things that we were trying to do through that was expand access to peer support and make peer support more available to people, improve the sort of training and the materials that are available to peer support facilitators, as well as the support, because we know that many people that facilitate peer support groups are looking for peer support themselves as facilitators. How do you get a good debrief after a particularly challenging group session? We know that facilitators are struggling with these kinds of issues. So we have actually improved our materials that we use here in British Columbia, and we are making those available to folks across Canada. So we've revised those materials. We've actually gone through a process to tailor those to a range of cultural groups and to translate them. So those materials and the potential to participate in some of our training for facilitators will be more and more broadly available. So we've had folks from the People in Pain Network in Atlantic Canada participate. We expect to have folks from AQDC in Quebec. So this is because our trainings and materials are pain specific. I think to your question about the broader funding of peer support, this is something that we're hoping to tackle in subsequent years. There's all kinds of legal and financial kinds of issues. I'm sure you're aware of some of them with the Canada Revenue Agency about how you can flow money from registered charities to other organizations. So some of those recent changes with CRA actually make it a bit easier for an organization like Pain BC to provide some flow through dollars to other organizations. But we obviously need to figure out a strategy to do that. And that's something that we are currently discussing. One of the challenges we've seen is just that there are so many condition-specific organizations, and we're trying to lend support to those, but also knowing that our mandate really is broad chronic pain and not just disease or condition specific. So I hope that answers your questions and that we have some practical support currently available for groups across the country doing pain specific work. And we hope to be able to provide more over time. I'm happy to take other questions. Thanks, Jenny.
Thanks for that, Maria. I have nothing to add to that, but you know, if another question does come up from this person, I'm really grateful, Maria, to your support here. One person had put in the chat that their chat was disabled. I think they were the one who raised their hand earlier, and this addresses the survey question that Susan and Sage put up, which was what was a barrier. And they said that depression is a barrier that stops them from joining groups. And I want to acknowledge that mental health is indeed a barrier to accessing all sorts of supports. And so thank you for bringing that up and being really open and honest about it too. I think mental health is, and there was a webinar just last week with Pain BC about mental health and chronic pain. That mental health is such a crucial, almost intertwined aspect of living with chronic pain. So I wanted to thank you for bringing that up.
Yeah, I really appreciate you raising that as well. And I think if you're living with pain and depression, showing up to a peer support group, there's a big leap there in terms of energy, in terms of feeling like you deserve that, feeling like you're ready. And there's, you know, with depression comes hopelessness and a feeling like, you know, is that really gonna help, or can I do this today? So making small steps. And I think there's a lot of themes to me, even just related to time and energy and mental health, and that maybe we need to think about some pathways to these support groups that eventually people might end up joining those groups, but there are maybe perhaps some first steps that need to happen first. In terms of maybe getting connected with mental health support to be able to do that. Are there some smaller bite-size ways to connect that don't require showing up for a whole hour or feeling like you have to show up for an hour? Maybe it's even just how we present these groups, that it's, you know what, even if you just come for a few minutes and drop in and don't even show your face or anything, just pop in, and that's okay. There is no participation that's too small when it comes to these, and maybe that could help. But I think it's something that we really need to consider, because we know, I mean, the prevalence of mental health challenges in those that live with pain is huge. Anxiety, depression, and so on. So yeah, thank you for bringing that up.
Thanks for contributing there, Susan. I think that I echo what Jenny and Susan have said. I think that first of all, I appreciate you sharing that, and I think that there are all of these things that definitely make it difficult to attend. So thanks for sharing that. There's another question and comment in the chat, and I'll read it out here. As a long-term community volunteer and advocate, I find it frustrating that organizations like ours have to rely on funds from people who are already on limited income or disability income / benefits to operate and survive. Even a $15 annual membership fee can be inaccessible to some. Would your organization be willing to organize a focus group with peer support groups across Canada, not just in BC, to speak to leaders about our challenges and needs? If we perhaps collaborate and work together to raise our collective voices as one voice, then maybe the government would take our needs more seriously. So I might ask Maria to jump in, but I think that this is something that I think is really beautiful about peer support more generally. And I think that, you know, this coming together is really this idea that is really present in peer support. And I think, you know, for the people that I've had the opportunity to meet who are doing peer support across Canada, there is really starting to be this collaboration that's happening. And especially it's helpful with Pain Canada, who is acting as this hub, right? So it's really hopeful when we can all come together. And, you know, like Pain BC has been, you know, putting together a list of peer support groups across Canada to make it accessible, not just for people who are facilitating peer support groups, but also for people who are interested in it. Because like I said, it has been, you know, in previous years hard to find. So, and then also things like making the facilitator training accessible to everyone. So, you know, I think given that there are quite a few, but still it feels at times not enough peer support groups across Canada, that working together and having that one voice can be really, really beneficial. I don't know, Maria, if you have a comment specific to the question.
Yeah, it's great to be part of this and hear from other groups outside of sort of the broad banner of chronic pain peer support organizations, of which there are a few. There are so many more that are peer support, whether it's arthritis, fibro, Crohn's disease, you know, different chronic illnesses that often have pain as a component. So it's something I'm taking away from this, and I'm going to look at how we can better support organizations that are doing this very grassroots and valuable work, even if they're not broadly pain organizations, but are more condition specific. So I actually didn't know as much about the needs of these organizations because I've been primarily in conversation with pain specific ones, but I think this is something we can absolutely look at. I can't make promises today about our availability to open up the training to all of the other condition specific groups across Canada, but it sounds like it's definitely a need and something that I'll take away and discuss with our team and try and make that happen. We just know the value of peer support, and we know that's for so many people living with specific conditions. You know, often we hear people say, my arthritis is well managed, but my pain is not. My MS is well managed, but my pain is not. So we know that often the issue impacting people's quality of life, their mental health, their sense of being stigmatized or even criminalized if they're using opioids, that pain is really the central issue for so many people. So I've learned a lot being here today, and can commit to taking away this question about making our training more available. And we can certainly circle back to people to let them know the outcome of those conversations. So if you're curious about joining our training, please ensure that we have your email and we can follow up with you. Thanks.
Thanks, Maria. I also just wanted to add, kind of related to this note of there being pains or certain condition specific support groups, that, you know, pain is such a, you know, there's so many different layers to living with pain. And there's also, you know, so many layers to being a human, right? And so I think that something that I know Jenny and I have talked about, as well as other people, is just the fact that sometimes, you know, you need peer support for pain, but then there's also this other aspect of you that is related to that. So I know that there are many wonderful groups that Pain BC has created that are not just support groups for people with pain, but support groups for people with pain, like Jenny was talking about, the BIPOC group, the 2S LGBTQ plus group. There are soon to be at Pain BC language specific groups because like I said, there are so many different layers, right? So even, I've spoken to people before about having a women's only peer support group for chronic pain because women specifically experience certain stigmatizations and are not as well believed. And so there's all of these different aspects of someone as a person that can be brought into peer support. And so having those specific groups as well lead to that even more understanding that can be there.
Thanks for that, Delane. As the facilitator of the Pain BC's BIPOC group, I can absolutely attest to what it feels like in my body to be in a group that are made of other bodies like me. And it's very different. And so often the things that we talk about are the themes that we talk about, the things that we introduce in the group. And it is a pretty small one. So I'm looking for people to come join us. That add that extra layer of what it's like to be a body living with chronic pain or chronic illness. So things like medical racism or perceived cultural differences in one's family, how our families deal with us living with chronic pain, and also like even, and I say this lovingly, even with the curriculum and the resources that have been very intentionally curated by that are available to us as facilitators, the majority of them, the people who talk about mindfulness, the people who talk about self-care, the people who talk about nutrition and sleep, they're white-bodied, and not to so it behooves me as a facilitator to really examine where these sources come from and if there are alternatives to these resources, and just I like to call it decolonizing the curriculum. So we think of things like that. I know that we're 2 minutes out, and Jacqueline brought up another excellent question, comment. So I'll read it out, and I know that we have 1 minute, and then another question came up. So part of the challenges, and I want to acknowledge it, even though it's probably not going to be answered in the very limited time we have. So part of the challenges that I face as the organizer of speakers is finding out the suitable resources available, i.e. staff representatives whose job includes patient or public education, to be available and speak online at health talks that we organize. Building a speaker resource directory is one of the things peer support groups would be great. It would be in great of. I'm not sure if I wrote that correctly. Besides training for peer leaders, cultural sensitivity, handling difficult people, and enhancing basic communication skills, so volunteers could be more included to step up to run programs and groups. I hope I'm not overreaching Pain BC education, but I think that, as Maria said, reach out to us, reach out to Pain BC, because I think we have your email. So perhaps we could start this dialogue in the same way that the four of us have started this dialogue together and created this collaboration. Whew, thanks.
Thank you. I think we will end it there, folks. And thank you once again for spending an hour with us, whether it is your noon hour or in the middle of your workday. So much gratitude for listening, paying attention, and asking great questions. I can see some more questions coming in. Yeah, like I shared, please don't hesitate to contact us on our email ID. And this will be recorded, and the recording will be posted on the Pain Canada YouTube channel in a couple of weeks. So please look out for that, and please share the link with anyone who would be interested. And I guess we'll leave it there. And I would like to share the Pain Canada webinar survey link. And thank you again. And we hope to see you at the next webinar on October 12th. Thank you.